Introduction to Informed Choice in Maternity Care, USA. In the United States, the journey of pregnancy and childbirth is accompanied by a myriad of medical decisions. Women often face pressure to conform to standard medical advice without fully understanding the evidence or lack thereof that supports such guidance. It is crucial for expectant mothers to recognize that medical recommendations are not always mandates and that they have the right to make informed decisions about their care. This empowerment is rooted in a firm understanding of patient rights, the ability to exercise critical thinking, and a clear grasp of the legal protections available to them. Patient rights and legal protections. At the federal level, the Patient Bill of Rights provides a framework that supports patient autonomy. This includes the right to receive accurate, easily understood information about health plans, healthcare professionals, and healthcare facilities. When it comes to maternity care, this translates to the right to know the qualifications of the health professionals involved in their care, and to receive complete and clear information about procedures, drugs, and treatment plans. Furthermore, the right to informed consent is a bedrock principle in healthcare. This means that before any medical procedure or intervention, healthcare providers must offer patients information about the risks, benefits, and alternatives available, including the option of not undergoing the procedure at all. The American College of Obstetricians and Gynecologists, ACOG, emphasizes that informed consent is a process, not just a formality. This process includes understanding the nature of the condition, the benefits and risks of the proposed treatments, alternative courses of action, and the risks and benefits of doing nothing. In addition to these rights, the Health Insurance Portability and Accountability Act, HIPAA, ensures that patients' health information is protected, while allowing the flow of health information needed to provide high-quality health care. Critical thinking and informed decision-making. Critical thinking is essential when navigating maternity care. Women should feel empowered to ask questions such as: 1. What is the evidence supporting this recommendation? 2. Are there alternative options? 3. What are the potential risks and benefits of this intervention or procedure? 4. Can you provide me with resources to read more about this? Women have the right to seek second opinions, to request access to their medical records, and to take time to consider their options before making decisions. They can also consult with patient advocates or maternity care liaisons who can help interpret medical jargon and assist in making choices that align with their personal values and preferences. Accessing and interpreting evidence-based information. It's important for women to understand that clinical guidelines, such as those issued by ACOG or the U.S. Preventive Services Task Force, are based on a review of the evidence, but they are not themselves the primary evidence. Women can ask their care providers for the primary research studies that inform these guidelines. Additionally, many hospitals and libraries provide patients with access to medical journals and databases such as PubMed, where they can find research articles related to maternity care. Navigating maternity care with the help of laws and rights. Each state may have additional laws and regulations that impact maternity care. Women can contact their local health department or a legal advocate for information on state-specific laws regarding maternity care. We recommend following Sacred Birth Doula on Instagram to get access to her Rights Over My Birth package for an empowered birth experience. Some states have explicit laws protecting the right to a vaginal birth after cesarean. As expectant mothers approach the often intimidating labyrinth of maternity care, it's essential to adopt a Socratic approach when interfacing with healthcare providers. This method, centered around asking probing questions, sharpens focus and ensures that the care provided is tailored to the mother's specific situation and is based on robust evidence. Here are some illustrative questions mothers might consider asking in the context of a pregnancy where a big baby is suspected. 1. Could you share the percentage of big babies who experience shoulder dystocia? And within that group, how many were following an induction? 2. Is shoulder dystocia exclusive to big babies, or is it a concern across all birth weights? 3. What is the rate of NICU admissions for babies who were induced? How does this compare to those who were not? Regarding the evidence that informs your practice, does it differentiate between outcomes for big babies without gestational diabetes and those with the condition? 5. Ultrasound estimations can vary. What margin of error should we account for? How does this align with studies like those conducted by Rossi et al.? 6. After diagnosing big babies through ultrasound, what has been the accuracy when compared to their actual birth weights? 7. In nature, is there a precedent for babies to grow larger than what their mothers can safely birth? If gestational diabetes is a concern, what dietary guidelines do you recommend to optimize both maternal and fetal health? For mothers who've experienced severe tears, particularly those who birthed big babies, how many of them were in a lithotomy position during delivery? These inquiries do more than just solicit information. They challenge the norms and encourage a healthcare provider to reflect on the individualized care they offer. They help mothers understand the intricacies of their care, the evidence behind proposed interventions, and the potential risks and benefits involved. It is through such an informed and critical dialogue that mothers can steer their maternity care in a direction that respects their autonomy, aligns with evidence-based practices, and upholds their rights as patients. This approach ultimately contributes to a birth experience that is both empowered and safe, reflecting the true preferences and best interests of the mother and child. In the pursuit of a birth experience that is as safe and empowering as possible, it's important to remember that you are not alone in this journey. If you find yourself needing further clarification, support, or guidance, please do not hesitate to reach out. Our team is dedicated to providing personalized assistance that can help illuminate the complex healthcare landscape. We offer one-to-one Zoom sessions tailored to your unique situation, assisting you in navigating the system with confidence. Additionally, we provide comprehensive courses designed to embolden you during pregnancy, equipping you with knowledge and tools to make informed decisions. For those who are inspired to extend this support to others, we also offer a certified course that prepares you to advocate for and empower expectant mothers within the healthcare system. Your voice matters, your choices matter, and we are here to ensure they're heard and respected. Together, we can strive for a maternity care experience that honors the rights and individual needs of every mother and child.